I want you to meet Amy. Amy is a middle-aged female who is reporting to your clinic with a gradual onset of right anterior hip and posterior hip into her knee pain. Upon kind of your initial screening of Amy as she filled out her body diagram, her primary areas of pain are kind of into her right anterior hip, noted as a tight ache, rated from a 0 to 2 out of 10 pain, getting to a 5 out of 10 pain with activity. Additionally, she reports having some anterior lateral knee pain that is described as a tight ache, sharp and grindy. And then finally, kind of her remaining kind of symptom is into her buttock, kind of more of this ache, really doesn't have any pain at rest, but does get to a 4 out of 10 pain with more activity. As you get into the clinical history of Amy, we notice that she is a 41-year-old female, notes having a chronic history of both anterior knee pain and hip pain. This started when she was in high school and has been recurring since then. This is usually worsened during and after pregnancies, but then improved again and gradually worsens over the past year. She has previously managed this with exercise, but has not been consistent with a routine over the past year due to family commitments. And for the most part, like I said, just notes this 2 out of 10 really persistent pain. Worsens with prolonged postures of sitting and standing as she is more of a desk worker throughout her day. As she sits longer, they continue to kind of gradually get worse. They do still improve with activity at times. Overall, just feels like she needs to stretch it, but doesn't feel like the stretching is providing that long-lasting relief she would be hoping for. As I'd mentioned, she is an office worker and really isn't in the clinic today because she feels like she can no longer manage her symptoms like she used to. She wants to be more active, but every time she does, she ends up feeling worse. So based off of this information, what clarifying questions would you like to follow up with Amy?